we're going to talk about body waxing and facial waxing. Body waxing has gained tremendous amount of popularity in the last few years. Hirsutis is the growth of an unusual amount of hair on parts of the body normally bearing only downy hair, such as the faces of women and the backs of men. Hirsutism is an excessive growth or cover of hair, especially in women. So it's also known as hypertrichosis. So anything that's hyper is overly active. It's excessive. So the first thing we would want to do is consult with our client. We want to make sure they disclose any topical oral medications, any medical issues, or skin allergies, such as a type of oil that may be in, essential oil that may be in your wax. Some of them do have additives that a person may be allergic to. Accutane orally, or either retinol or tretinoin topically, they would need to have discontinued those meds for 6 months. Because what it does is it thins the skin, and you can actually rip away layers of the skin and cause a wound. So make sure you understand that. So contraindications for hair removal: Accutane that we just talked about, blood thinners, chemotherapy, autoimmune diseases, prednisone or steroids, and skin diseases such as psoriasis, eczema, or other chronic skin conditions. We would not want to wax those areas. Autoimmune, an example of that would be lupus. There are other autoimmune conditions, so you need to make sure that you check with your client if they're doing any type of chemo, radiation, or taking any blood thinners. Because if you accidentally cause them to bleed in their own blood thinners, you know, it could possibly cause an issue because maybe you could not get the bleeding to stop. Skin lesions, you know, if there's any skin lesions present, such as pustules or papules, we wouldn't want to wax over somebody that have really active acne. A sunburn, you know, the skin's already compromised, it's sunburned, so we're certainly not going to wax on top of that. If they've had any cosmetic surgery recently, any laser treatments. People get lasering done to help with hyperpigmentation, dilated blood vessels, rosacea. Varicose veins, you know, if they have some severe varicose veins present, those bulging veins, you would not want to do a leg wax. Any bleeding disorders, circulatory conditions, conditions that may prevent waxing services. If they have rosacea, very sensitive skin, cold sores, because remember that's that herpes virus, recent chemical peels such as glycolic, salicylic, or recent microdermabrasion, any uses of topical exfoliators such as Retin-A, Renova, Tazorac, Differin, Azilix, those are brand names of different tretinoins, and any recent lasering of the skin, surgical peels, or use of hydroquinone. Hydroquinone is an ingredient that's used in a lot of products that help to fade hyperpigmentation. So here you have an example of a client intake form, or you can compose your own. This is just an example for you to view. Here's an example of a release form that you can have them sign to release you of any liability. Sometimes clients will not be 100% truthful and leave things out because they want the service done, and then you wind up having a problem. So make sure that you have them sign a release. So some other types of permanent hair removal, we have electrolysis. This is an electrical current that destroys the growth of the growth cells of the hair. Photoepilation, this uses intense light to destroy the growth cells of the hair follicles. And then laser is another method for rapid removal of unwanted hair. And these may take more than one session. And darker hair is going to absorb more light from the laser or photo. They're working on some methods in order to do lighter hair, such as, you know, some women get, you know, gray whiskers as we get older. And they're working on methods to where they could be able to have the photo or the laser affect the lighter hairs too. Electrolysis, this is removal of hair by means of an electrical current that destroys the root of the hair. It's electrical current applied with a fine needle-shaped electrode. The electrode is inserted into the hair follicle. It can be painful, time-consuming, and expensive. You have to be licensed as an electrolysis. You have to receive certification in order to do electrolyty. Photoepilation is known as intense pulsed light, or IPL. There's minimum side effects. It requires no needles. It can clear 50 to 60% of the hair in 12 weeks. And again, you would need to be licensed to do this. Laser hair removal. This is rapid removal. It's best in the anagen phase. It responds best to coarse dark hair, and it requires specialized training. You can get certified to use lasers in a cosmetic setting by the state of Georgia. I know a particular company that we deal with, Aesthetic Solution, they offer laser certification. Last I heard it was running about $1,500, and it was a more than one day course you'd need to attend. Some temporary hair removal methods. We have shaving, tweezing, depilatories, epilators, threading, sugaring. So shaving, most men shave their facial hair. Women, we shave our legs and underarms. It's quick and convenient, but it can result in irritation, ingrown hairs, and nicks from the blade. You want to make sure you're changing your blade or your razor at least weekly in order to make sure you're using a sharp razor, because that's how the irritation and the razor burn can occur if your razor is not fresh. So tweezing, this is used to shape the eyebrows around the mouth and the chin. Is considered undesirable. It can be a little bit more painful. The natural arch of the brow follows the orbital bone in the curved line of the eye socket, and consultation is used to avoid mistakes and to ensure client satisfaction. So here's a way that you can determine the best shape for someone's eyebrows. You can use an eye pencil and mark where these lines are landing in the brow. So where should the brow begin? You're going to hold the base of a comb or spatula against the corner of the nose, with the other end of the comb or spatula extending upward toward the eyebrow. This is where the eyebrow should begin. So they're speaking of this area here. You see the corner of the nose? So that's where your eyebrows should begin. Where should it end? You're going to hold the comb or spatula, and it extends from the corner of the nose to the outside corner of the eye and then across the eyebrow. The high point of the arch of the brow should be near the outside of the iris. So if your client's looking ahead, it should be near the outside of the iris. And then the brow should end from the corner of the nose, corner of the eye to here. So that's a good diagram to show you how to shape someone's brows. Maybe you have someone come in, they've never shaped their brows. There's not something there for you to follow. Depilatories, these are substances that are used for temporary hair removal of superfluous hair by dissolving it at skin level. They contain detergents, adhesives. They expand the hair and break disulfide bonds. What else does that? What else breaks disulfide bonds? Chemical relaxers, maybe? These would require a patch test. So here they're talking about your Neat, your Veet, your Nair, whatever brands are out there. So these are caustic alkali preparations. They're used for temporary removal. They dissolve the hair at skin level. So they're containing chemicals like sodium hydroxide. Where have you heard that one before? Potassium hydroxide, thioglycolate acid, calcium thioglycolate are used to destroy the bonds. So epilators, wax is considered a type of epilator, whether you're doing a hot or cold wax. And we use this in the brows, cheek, chin, upper lip, arms, and leg areas. And then you've got your hard wax, that you don't have to use a strip. And then you've got your soft wax that you do use a strip and use some type of spatula to spread it on the area. So it just depends on what works well for you. Hard wax, I think, tends to work more on the body. Not that you can't use a hard wax on the face, you can, if it specifies that it's for that use. So some safety precautions for waxing. We want to test the wax temperature. We want to make sure we avoid wax contact with the eyes. We never double dip. We do not want to wax over warts, moles, abrasions, or irritated or inflamed skin. You can use hard wax on more sensitive skin, and then we're going to use aloe gel to calm and soothe. And we use a line with satin that we cleanse because we want to remove all makeup, oil, and dirt on the face. All of their line is antibacterial. So antimicrobial, because when you're pulling hair out of a follicle, you're opening the pores, and sometimes you'll get that little white pimple. It's because bacteria got into that follicle and caused a little infection. So that's why we need to cleanse the area. We have an oil to help remove any wax that got left, or if you make a oops and maybe the wax spread into an area that you did not want to wax, you need to use the oil to remove that. Because if you go ahead and pull, it's going to pull that area where the wax went in that place that you did not want it. We use the oil to remove any stickiness left on the client. Then we can apply aloe, and some of them contain a lotion that you can also use to help soothe the redness and the swelling that can occur after waxing, and to calm and cool the skin. So hair removal procedures, these are listed in your book. The pages are listed here for you, so you need to review those. Threading, this was practiced in Eastern cultures. It involves the manipulation of thread, and it's twisted and rolled on the skin surface, and it's entwined and lifted from the follicle. And again, this requires specialized training. I've had this done, and to me, it's more uncomfortable than waxing. But again, it varies from every individual. Sugaring, this is an epilatory treatment that produces the same results as hot or cold wax. It uses this thick sugar-based paste. It's appropriate for sensitive skin. So you take a ball of this sugaring product, and you can spread it. You use gloves, you spread it with your fingers, and you're taking it off like a hard wax, and you can keep using the same ball, up to a point that it becomes so hairy you need to get another one, and it's easily removed from the skin. So that's why some people like the sugaring method. So depilation is removing hair at the skin line, such as shaving and using chemical depilatories. Epilation is removing below the skin line, such as tweezing, waxing, and electrolysis. And again, as a licensed practitioner, you'll be asked to remove unwanted hair, especially the eyebrows and the facial hair. Shaving does not make your hair grow back thicker or coarser. The reason it feels stubbly is because you just blunted off the hair at the skin surface. It does not affect how the skin or the hair will grow back. So if you should choose to specialize in aesthetics, you'll want to become proficient in other hair removal services as allowed by the regulatory agency in your state. It's extremely important to follow cleaning and disinfection guidelines, because remember, we're opening up pores. We want to cleanse and treat the area prior to the service, and then apply antiseptic, antimicrobial products afterwards. And we want to follow safety precautions to protect the client from skin irritation. All right, so here's some review questions that you can ask yourself to help you go over. So what information should be entered on the intake form during consultation? Your client should disclose all medications, topical and oral, along with medical conditions, skin disorders, or allergies. What conditions, treatments, and medications contraindicate hair removal in the salon? Clients should not have waxing performed if they have been taking Accutane within the last 6 months, blood thinners, undergone chemo, radiation, taken any medication for autoimmune diseases, prednisone, that's a steroid. They should not receive waxing services if they have psoriasis, eczema, chronic skin disorders, sunburn, pustules, papules, or other lesions. And they should also not receive waxing services if they've had any recent surgeries, laser skin treatments, varicose veins, bleeding disorders, or any other medical issue. What are the two major types of hair removal? The two categories are permanent hair removal, which is including electrolysis, photoepilation, and laser hair removal, and temporary, which includes shaving, tweezing, depilatory creams, hard wax, and soft wax.